Ahmad Abdul Hai, Director Surgery, PARAS HMRI Hospital, Patna. Surgery has undergone a sea change, and this sea change has come because of multiple factors. And one very great factor is, of course, changes taking place in surgery itself. But equally important have been the changes taking place, for instance, in anesthesiology, changes taking place in antimicrobials, changes taking place in the industry. And all these factors have made surgery a different cup of tea today than what it was when I was a medical student, for instance. So the changes are certainly there, and they are welcome changes. But as with any change, a change comes with something positive and something negative. These are the positive things about which I told you, but certain negative things have also come up. And I sometimes feel that because the industry has played such a big role, maybe we are getting a little bit more industry driven than what we should really be. Our focus should be on the health of the individual. And one sometimes feels that directly or indirectly, the industry tries to drive us towards a particular path. I remember very well when the first man landed on the moon. I had gone to Chicago, and there was an exhibition to show the rocks which they had brought back. And I looked at the rocks and said, what's so funny about these rocks? What's so great about these rocks? They're just the same rocks which you see lying on the streets of Patna by the side of the road. But that was the negative part. But when you look at the other part, say the fact that they were able to communicate, that the fact that they were able to bring the pictures, the fact that they were able to use fiber optics. I mean, that same fiber optic now gave us such beautiful endoscopes. Now you can put in a tube and visualize the lining of the stomach. You can put in a tube and see the intestine from the lower end and see the colon inside, a colonoscopy. You can put in a tube and go into the hepatic duct and put a dye and see things. So the developments which have been designed for whatever cause are now being used in the medical science for a very, very positive and a very, very practical purpose, and it has definitely shown impact. Today, for instance, I was operating on a patient. This gentleman, someone shot him with a gunshot wound, and he came from about 40 kilometers away from Patna. Now, he came, he had no pulse, he had no urine, the kidneys are all stopped. Now, we were able to dialyze him, we were able to give him blood, we were able to do certain drugs we were able to give antimicrobials, and I think that there is a 50% chance that he may survive. This would not have been possible, say, 30 years back. So things have changed, and they have changed for the better, and but they have come at a cost. One cost, what I was mentioning, was the industry driving. Another fact is the affordability. You mean, today, this sort of hospital is affordable to maybe 10% of the population of Bihar. 90% of the population, although we try to make it down and though we are trying our best to make it more affordable, but 90% of the population will not come. Our brothers who ply the rickshaw on the streets, he will never think of coming here. Although, in his heart of hearts, the desire is there. You know, after all, he is just as much a human being as you and me. So the desire is there, but there are certain limitations which prevent him from coming. And I think this is one very, very big challenge today before not only the medical profession, not only the government, but society as a whole. How do we make healthcare affordable and available to the common man, to the average Hindustani living in Bihar or Maharashtra, wherever he lives? Sorry, sir, I can't give you a very rosy picture because the picture is not at all rosy. We are way down the list. And one thing we must understand, that healthcare is not something isolated. I mean, I'll give you an example. Say, look at Kerala and look at, say, Maharashtra. Now, financially, economically, the amount of money generated in Maharashtra is many, many times more than the amount of money which is generated in Kerala. But if you look at the healthcare indices, say just take infant mortality, maternal mortality, they are much, much better. Nearly, I think in some cases, I'm not aware of the recent figures, but they are as good as international figures in some of the protocols. Why? Because they have education, particularly female education, which is nearly 100%. So, healthcare is a mix-up of a lot of things. And one important thing is education. And of course, the other thing is the role which the government plays. And of course, the private sector plays, and maybe a partnership between private and PP, what as we call private and public sectors. The health scenario in Bihar is bleak because of various factors. Our educational status, unfortunately, is not good. Our ladies, for instance, are not educated. And if a lady is not educated, then she never understands the value of immunization, for instance. If a lady is basically educated, she understands what immunization means to her. And the general level of sanitation, today, a lot of diseases can be prevented. Say, I'll give you one example of cancer. Because I talk of cancer because cancer has been something very close to my heart. And I feel that it's very important that we should talk of cancer prevention. And if you look at the entire scenario of cancer in India, I think 50% of our cancers are preventable. If we do 2 or 3 important steps, one is we shun tobacco in any form, whether it is smoking or canning or smoking or smokeless or whatever. But you'll be sorry to learn that Bihar has got one of the highest consumption of tobacco. The average consumption of tobacco in the whole country is around 33%. Bihar, the last survey done, we were at 54%. Alcohol. Now, the tobacco industry is very great. They are very powerful. They can dictate terms. The alcohol industry, I think, is even greater. They can dictate terms. And therefore, although we have been talking for the last 30 years, it has not yet percolated into the grassroots level that tobacco and alcohol can be a great cause of cancer. Obesity. I just said 4 things: tobacco, alcohol, obesity, and lack of physical activity. Now, what prevents you from taking the staircase rather than using the lift? What prevents someone in the village from allotting, say, 20 minutes of his time to walk to his field and up and down and then do whatever he likes? Physical activity and something what we call a balanced diet. A balanced diet doesn't necessarily mean a very costly diet, but it should have something, a little bit of protein in it, a little bit of vitamins in it, some fresh fruits and vegetables in it. And if these 4 things can be taken care of, tobacco, alcohol, physical activity, which also means less obesity. If you are physically active, you are likely to be less obese, and proper care of diet, what you eat. I think we can cut down 50% of our cancers. Unfortunately, you see, the government, the focus, every government has got a focus. And the focus here is not on preventive health. The focus is on curative health. The reasons are obvious, curative health, the results are much more glorifying. Your patient comes with acute pain in the chest, and someone puts in a stent, and he goes back smiling. Everyone is very happy. We have achieved such a great thing. But this thing, if you really go into the economics of it, prevention is the only way to improve our health of the Indian community. And number two, we must spend more on healthcare. This budget of 2% and 1.89 or whatever they say percent, I feel that it is absolutely unacceptable. We spend so much on buying jet fighters, which are thousands of crores. One plane costs thousands of crores of rupees, and you will keep it for 5 years, 2 years, and then it will become outdated because new model will come. So another 1,000 crores will be spent to get the newer model. Why can't we spend that money on health? So there must be more spending on healthcare, must be more prevention rather than curative. I'm not saying curative is very important. After all, if I get pain, I will not talk about curation. Curative should be there, but the stress should be more on prevention. And perhaps the time has come when we should think of the health policy of a nation as a whole. You know, we have been copying Western models. The American model of healthcare and the Scandinavian model of healthcare, they are very nice, very bright, but Patna is not New York. It's not even Oslo. Patna has its own problems. You can compare Patna with maybe Kathmandu, you can compare Patna with, say, Karachi, but you can't compare Patna with Oslo and New York. So we have to put our heads together, the medical people, the administrators, the economists, the healthcare providers, and make out a good, workable healthcare policy which works for our nation. I had the privilege of working in a government hospital for nearly 30 years. I started as a medical student and retired as the head of department of surgery. And it has been a great experience. Great in many ways. On a personal level, you know, when you operate on someone, I remember a patient came, this was very early in my surgical life. Patient came with an acute perforation of the intestine. At 2 o'clock at night, you know, we're on duty, you go and you operate and you close up. And then when that patient is going home, he has obviously no money. We are barely able to take care of the medicines. Sometimes we ask these medical reps to supply them with some medicines. And then the old mother comes up and she just holds your hands and starts weeping. She doesn't even have the words to say thank you. And that gives you an inner gratification which perhaps very little thing in this world will give. So that was one great part of working in a government hospital. But in all these years, I could not improve it even to 20% of what I had wanted it to be. The corporate hospital, the advantage is that money is not such a big issue. It's a big issue, but not such a big issue. We are able to get things done. And one very good thing which I feel here in this hospital is, you know, this dream was there in my mind for last 20 years, we'll have a good hospital. That this regular going of patients from here to Delhi and Bombay and Chennai has to an extent been curbed. I won't say completely stopped, but curbed. And the same doctors from Bihar who are doing so well in, say, Bombay or Delhi, many of them have come back here. They are giving services here. And so this also gives me a lot of satisfaction that today, at least this movement from Patna to Delhi for healthcare has to an extent been stopped, and I feel very, very proud of it.